All right, so from this kind of a heart, we can see apex, we can see the heart wall layers, visceral pericardium or epicardium, myocardium, endocardium. We can see this. The outer would be the fibrous pericardium of the pericardial sac. The inner would be the parietal pericardium of the pericardial sac. So that's about all this is good for. There's a nice papillary muscle and chorda tendineae. And a nice look at the difference in myocardia. Left side thick, right side thin. Then we can trace our way. Oh, nice auricles here. Those are the ears. Then if we start off over here, we can see the dimple in the right atrium is the fossa ovalis. We can see this superior vena cava and this inferior vena cava. And the third thing that enters into the right atrium, coronary sinus, which would be going into the coronary sulcus. Oops, I just poked through the coronary sinus. But there's the vein that drains the heart. That's the only cardiac circulation one from the sheep heart you have to know. So those are all the right atrium features, except for you'd have SA node up high, AV node down lower. Then here is the tricuspid valve with its chorda tendineae and not as big of a what? Papillary muscle, because not as much force. Right ventricle carrying what kind of blood? Deoxygenated blood. Now pulmonary trunk is going to go up around the surface of the heart. We're going to see the pulmonary semilunar valve. Here is one of the flaps. So this is the pulmonary trunk. See, that's thick-walled, that's an artery. And the pulmonary semilunar valve is, there's one of the three cusps for it. Okay? Blood goes to the lungs, comes back to the left side of the heart. See, left ventricle. And up in here, if we feel around, oops, that's too big. That's where multiple pulmonary veins would be coming in because they cut it so tight. There's the left atrium, left ventricle. Here's the bicuspid valve, very large papillary muscles with chorda tendineae. Oh, on the right side, what did the sheep have that you don't have? Bonus? Moderator band.
All right.
Okay. The irregular arrangement in the ventricle is the what? Trabeculae carnii.
Yeah.
And then up high, if we see it in an atrium, I didn't look for it that well, but if this looks like the teeth on the comb, kind of parallel mostly, that would be the pectinate muscle. Back over here, we sliced all the way through. Here is the aorta. There's the brachiocephalic. That'd be a good bonus, right? See how that's the first branch off of it?
Yeah.
If we open this up, we now can see the, what's this valve? Aortic semilunar valve. And any little holes nearby would be what? I think maybe there's one. Coronary arteries. Okay, so way down here at the base of the aorta, yeah, there's the other. That's where the coronary arteries head off to the heart muscle itself. So yes, aorta, and then we're coming back to the other side of the heart. That's it.
All right.